Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for today, October 13th, 2020. I want to start by acknowledging that I'm standing on the traditional territories of the Lekwungen-speaking people of the Esquimalt and the Songhees First Nation, and we're, as always, grateful to be on these traditional lands. We are reporting for 4 reporting periods since we last reported out on Friday, and between Friday and Saturday we had 170 new cases diagnosed. Between Saturday and Sunday, an additional 159 new cases. Sunday to Monday, 119 cases, and Monday to today, 101. That is a total of 549 cases over the past 4 days, including 5 epidemiologically linked cases, bringing our total in British Columbia to 10,734. I do want to note that this was, as you know, a long weekend, and there had been some accumulation of tests that we'll talk about in a minute. That includes, our total includes 3,892 people in Vancouver Coastal Health, 5,595 people in the Fraser Health Region, 235 in the Vancouver Island Health Region, 582 people in the Interior Health Region, 341 people in Northern Health, and 89 people who normally reside outside of Canada. We currently have 1,476 active cases, of whom 77 are in hospital, 24 of whom are now in critical care or ICU. Sadly, we've had 5 additional deaths over this long weekend, 2 in the Fraser Health Region and 3 in the Vancouver Coastal Health Region, bringing the total number of people who've died from COVID-19 in British Columbia to 250. And our condolences go out to the families and the care providers and the communities of these 5 people who died at a time when it is so challenging for us to come together and to mourn and to remember. We have 3,618 people currently under active public health monitoring and 8,974 people who are now recovered. We have 4 new healthcare outbreaks to report over the past 4 days. The PICS Assisted Living Facility, Chartwell Charrington House Assisted Living Facility, Yaletown House Long-Term Care Facility, and the Weinberg Residence Multi-Level Care Facility, and those are all being posted on the website. In addition, we have 2 outbreaks have now been declared over at the Evergreen Hamlets and at Charrington Place. That leaves us with 20 active outbreaks in our health care system, 17 in long-term care and assisted living, and 3 in acute care. And we're up to 919 people who have been affected in long-term care, 533 residents, and 386 staff. While we have no new community outbreaks to report, there are continuing to be community exposure events, and those again are posted both on websites and on the Health Authority websites and the BC CDC website. I'd like to speak for a moment about the higher case numbers we saw over this weekend. Firstly, of course, that it was over a 4-day period than our usual 3-day weekend reporting period. But the numbers are higher than what we would like to see, and on average are higher than what we were seeing in the past week. But it is important to look at them in context. As we know, our lab teams are working to process as many tests as positive as we've increased our numbers over the past week. And as there were a number of events that conspired so that at the end of last week there was a bit of a backlog, and those were cleared over the weekend. And the team at particularly at the BC CDC, but at a number of our other partner labs, processed essentially an extra day's worth of tests, about 6,000 tests, to clear that backlog that had emerged. And these were primarily in the Fraser Health Region, and we see that in the numbers that have been, that we see are positive in the Fraser Health Region as well. These tests identified new community cases and exposures, which tells us again that our testing strategy is working and that the backlog has now been cleared, and we are working to make sure it stays that way. We are finding people who are positive with COVID-19. And while clearing the backlog meant an increase in the overall number of confirmed cases, the active cases and the percent that are positive remain stable. We continue to be under 2%. Over the past weekend, it was 1.39% of the tests that were done were positive across British Columbia. Despite the thousands of people getting tested, 39,170 tests from October 10th to 12th, our positivity rate remained, as I mentioned, at 1.39%. And this is where we want to be. We want to be able to be picking up those cases in the community and make sure that we are doing contact tracing on every single one. We are also, however, working on a province-wide plan to ensure that our testing system is operating as efficiently as it can be, and that includes, as we talked about last week, there are several different platforms that are in use across the province, and there's a pre-test piece which has had some challenges in terms of booking a test, getting in for a test. There's the processing piece, and we are at the mercy of certain shortages worldwide on reagents and things like that. And also there's the post-test reporting out. And I look forward to sharing more information about how we're increasing the efficiency in all those areas in the coming weeks. While we haven't had any community outbreaks in the last couple week or so, we do continue to see community exposures, as you know. In large part, this is because we know that the symptoms of COVID-19 can take several days to develop, and for some people can be very mild. Recently, over the last weeks, we've seen an increase in community exposures connected to recreational sports like hockey and soccer as they've started slowly to restart. The result has been that some sports facilities have needed to close or to shut down for periods of time. We know that physical activity is important for our overall health, and from the beginning, we've encouraged people to go outside and to be active, and we know as well that it's incredibly important for young people and for our school-age children. As with many other activities that have restarted, these facilities, sports leagues, and recreational organizations needed to have a COVID-19 safety plan, and we've been working with the organizations to make sure that those are guided by public health principles to ensure that we can have a safe return to sport. And like the recent NHL playoffs, the plans have prioritized the players over the spectators. And I know that's a challenge for some people who want to be there to support their children in particular who are playing on teams. But we also know that spending time socializing or cheering with other parents and fans before, during, and following games increases risks of transmission and exposure for families. That's why there are restrictions on spectators in arenas and on sidelines of games. And it's important for all of us to think about our cumulative interactions. The more time we spend with others in one area means we have to be careful about spending less time in another area. If you're in a busy workplace, have children in school, then it is all the more important to limit your time with others on other, whether it's social events or recreational sports and other areas. As much as you may want to see the winning goal or celebrate that perfect pass after the game, we need to ensure we are keeping ourselves and our loved ones safe. And the best way to do that is to follow our COVID-19 safety basics on and off the field. I know most people are doing the right thing, but I ask that you keep this top of mind. It is important for us as communities across this province to keep our workplaces open, and essential that we keep our schools open for the health of our community and for the health of our children. This new normal is new, and it's new for all of us. But it is not forever, it is for now. And that means if you are playing in a sports league, pick one league. Don't pick multiple leagues. If your children are involved in activities after school, pare it down so that they're not exposed to large numbers of different groups of people at different days. Our actions today have a direct impact on how our province will fare tomorrow and in the weeks to come. And we know that we can do this. We have seen us flattening our curve again We've kept our numbers in control, mostly through the work that we're doing together to keep our interactions safe, and the work that the public health teams are doing to follow up on individuals. Each day and month that you choose to do the right thing, you're helping to protect all of us. You're in keeping our important activities and places open and safe. And just as we did this past weekend, let's continue to find new ways to support each other and show we care at a safe distance. Please take a moment today to think about what you are doing and what you can do to make yourself and your family safe. Let's remember that we are stronger together by staying apart. And we will get through this by continuing to be kind with each other, to be calm, and to take that time to recognize that we all have our own reactions to how we are getting through this pandemic, and we all need to be safe. Thank you, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. Please also take your phones off mute. You will not be audible until your name is called. First question is from Ashley Wadwani, Black Press.
Hi, Dr. Henry. A new poll out today suggests some varying views on the flu shot this year, causing some health officials, that I've spoken with to voice concern about what they're calling a twindemic, I guess, which is when flu season collides with the ongoing pandemic. It found that essentially 1 in 6 people polled said they feel that because they have not yet contracted COVID-19, they aren't really worried about getting the flu. I'm curious on what your thoughts are when it comes to British Columbians who are questioning whether they should get the flu shot or not this year.
Yeah, so there's a number of reasons why it's important for us to be aware of influenza this year more than ever. And that's because even though we know we may be healthy, we may not feel we're at risk, we can pass it on to others who are at risk as well. And the flu shot is effective and safe. And we know that children and the elderly are more likely to have severe illness from influenza, and so they need to have priority for being protected. But we also know that that influenza can spread very rapidly, and it can lead to, every year we see it lead to people needing hospitalization and care, whether it's in the children's hospital or adults. So this is the year where we all need to do what we can to keep influenza as low as possible in our community so that we're protecting our healthcare system, but also so we're able to tell the difference between COVID and influenza, and it makes it easier for us to know if somebody has COVID as well, and we can manage both of these epidemics at the same time. We know that influenza will be coming, and we know that we can take measures to protect ourselves and our families by being immunized.
Ashley, do you have a follow-up?
Yeah, I do. So this is about something a little different. In Ontario, there was just an incident that they're calling basically a super spreader event where at least 60 people were infected with COVID-19 after an asymptomatic person went to a fitness studio. And that's despite the studio there taking temperatures, keeping people 6 feet apart, and masks being worn except while exercising. I was just curious, are you worried about any similar events happening here, or maybe considering more public health orders despite the measures being taken by specifically fitness studios and gyms?
Yeah, so we did actually have a number of super spreading events ourselves, and that what marks them as super spreader events are somebody with mild symptoms or minimal symptoms is in an area where it's enclosed, where there's lots of other people. So we do have measures in place, and prior to in March and April, before we closed down gyms in BC, we had been seeing quite a bit of transmission in some gyms around the province. Since we've reopened, the COVID safety plans that have been in place have not led to, we've had a couple of exposure events, but we've not had a lot of transmission in gyms so far, and it is something we need to watch very carefully. So we aren't looking at changing any of the public health orders we have in place right now. But I will say what we have tried to do on a community level is find those situations where these types of events are more likely to happen. And that's one of the reasons why we shut down nightclubs and some of the late night bars and the banquet halls, because we were seeing transmission, and sometimes to large numbers of people. As you know, there's a limit of gatherings to 50 here in the province, but late at night, in some of these environments where people were mingling, particularly if alcohol was involved, we were seeing that people could be exposed to, could be exposing larger numbers of people, and it was difficult to find them. So those are the measures that we've taken to try and reduce the probability of this happening here.
Ethan Sawyer, CBC.
Hi, Dr. Henry. My question is about backlogs. I just was wondering, you mentioned that some procedural changes are going to be made to avoid backlogs moving forward. I was just wondering if you can kind of outline what those changes will be.
Yeah, well, we've been pretty good at titrating around the province where testing is being done and which labs have capacity, but we need to optimize that. So it's been described to me as similar to air traffic control, making sure that we're using all of the capacity that we have in the different labs around the province. And what happened at the end of last week was a little bit unusual. There were some challenges in one of the labs, and the default was to send it to the public health lab, the BC-CDC provincial public health lab. But now we're looking at better ways to manage that and distribute the testing capacity if needed. But there's a number of other things we've talked about around scheduling and around resulting as well that we're hoping to improve the efficiency of.
Ethan, do you have a follow-up?
Yeah, I do. Kind of similar topic. Are you at all concerned that the delays in getting negative test results back might act as a disincentive for people moving forward, for people who are considering getting a COVID-19 test, even if they only have mild symptoms?
Yeah, absolutely. That is a concern, and that's one of the things that we want to address. And I think we have to be very careful, particularly if people know they've been exposed to somebody with COVID-19, that we have been very effective at getting the positive test results back to people, but there are occasionally delays in those as well. So if you are waiting for a test, you do need to take measures to reduce your interactions with others. And if you're somebody who was exposed in whatever setting, you should be self-isolating until you get those test results back. And we recognize that that can be a burden for people, which is why we're trying to decrease the amount of time that it takes on both ends, both to get the test and to get the result for all the results.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thanks for taking my question. Just regarding the concerns about sports leagues and recreational, are you suggesting now that students in high schools that are playing sports on recreational teams no longer play school sports, or how do parents reconcile that as far as what's the message being sent to young people who may play in the community as well as on team sports?
Yeah, no, I think we need to encourage students, and we know that it's really important both in the school and extracurricular activities, but they need to be done in a way that reduces the risk of exposures to large numbers of people. And what I'm really talking about is the concerns that we've seen where there's been some situations where parents have been together on the sidelines, or the teams get together afterwards, and it's not just student sports. But I would say that if you're playing school sports, pick one other sport, not two or three different events or different activities in the community outside of school. This is a year where we need to cut back on those types of interactions, recognizing that for every group that you're with, the potential increases that you could be exposed to the virus. We know that that's why we have measures in place to try and keep people distant, keep spectators away, so that we're reducing the number of chances for that. But this is a year to not fill up every night with a different group.
Do you have a follow-up, Marcella?
Yes, regarding the 5 deaths that were recorded over the long weekend, would you happen to have at your fingertips the number of people who have now died in long-term care across British Columbia?
Yeah, and none of the 5 on the weekend were in long-term care. And I don't have the total at my fingertips. I should have it. I believe we're at, I will get that number to you.
Next question is from Laura Brom, CFAX 1070.
Hi. So over the weekend, it was Thanksgiving weekend, and a lot of people decided to, despite your recommendations, to gather together with family in large groups. So because of that, are you expecting to see a surge in 2 weeks similar to like what we saw after Canada Day?
I'm hopeful not. I think a lot of people and most people did the right thing. I know there was some people who traveled. Um, we've heard of larger groups. Sometimes we see them outside. Hopefully, people took this to heart and did take the measures that we are expecting people to take right now. And really, it's about protecting those who are close to us. We would, however, see transmission events happen. Usually the time period between exposure and somebody testing positive or developing symptoms is 5 to 7 days. So this week will be important for us to be monitoring extra carefully for that.
Do you have a follow-up, Laura?
Yeah, it's on a different topic, but so we've been seeing that COVID results in long-term health issues, and I believe you've said we've seen this in BC. So I was wondering how many instances of ongoing health issues we've been seeing in BC so far.
Yeah, I don't have that information for you. It's very challenging. We do know that there are some clinics that are following people, particularly people who were hospitalized, but also people who were in the community. And there is ongoing efforts to try and have a collaborative research group across the country to support people, both people who tested positive during the past few months, and people who have not yet been tested or don't have antibody tests, have not yet had an antibody test who are having symptoms. So I don't have numbers at this point. There are several clinics in the Lower Mainland in particular that are looking at following people, and there is a process nationally to try and develop more.
Next question is from Catherine Garrett, MyPG Now.
Hi, thank you for taking my question. Regarding the third case of COVID-19 that was announced at Site C earlier today, is there any confirmation if this individual is a BC resident or if they traveled in from out of province?
I don't know the answer to that. I do know that that the person had very limited exposures and that the processes that they have in place at Site C were in place and were working. But I don't know if it's a BC resident or not.
Catherine, do you have a follow-up?
Yes, I do. Was this individual already connected to a known case, or is this considered its own cluster?
I don't have that information, I'm afraid. We can find out for you.
Craig Takuchi, Georgia Street.
Oh, hi, Dr. Henry. I was wondering, since there seems to remain ongoing differences between what those in the school system are saying they are experiencing or seeing and what you've been explaining, I was curious, what is your assessment of this gap in viewpoints or understanding, and what do you think can help to bridge that gap?
Yeah, I'm not sure I agree with you that there's a gap. I think there's a lot of things that are spread on social media that may or may not have a complete picture for certain people. I also want to say, look at the work that we're doing in the schools. Every exposure event, so this is not necessarily a risky event at all, but every exposure event is being reported publicly so people know how many people have been in the school setting, and public health teams are following up on every single one. And we have not seen outbreaks in our schools yet. It may happen, but we've not seen that. Where we have seen is sometimes there will be a transmission between one or two people within the school setting, whether it's adults or children in the school setting. But we've been very above board with this. We've put every exposure out, and public health teams are following up with every single case.
Craig, do you have a follow-up?
Oh, yes, please. As we head into flu season and with students back at school, can you clarify how important it is to sanitize surfaces? Because there's been some discussion and debate on an international level about transmission of the virus from surfaces. So I was wondering, what is your evaluation of the risk level of that transmission?
I know it is challenging. You know, we talked about this earlier on, and then we learn more about the virus and where it lives and where it doesn't live so much. And then I know there's a recent laboratory study where they showed that they could keep the virus alive in certain surfaces in a laboratory setting for long periods of time. But we're not seeing that being a major source of transmission in most community settings. It can be an issue, particularly in healthcare, where we have a lot of people with a lot of virus. But I think what we are seeing in community settings is that, especially outdoors, the virus does not live very long. And indoors, really important is routine cleaning of those high-touch areas and making sure that we're cleaning our hands and not touching our face. This virus doesn't get transmitted through the skin. So if we're touching something or a surface that has virus on it, it can get into our system if we rub our eyes or we put our hands that are contaminated around our nose or mouth. So those are the things that we need to pay attention to, and that's why we talk about cleaning your hands regularly, making sure we're careful about not touching our face, and cleaning our surfaces routinely. So those are things that are good advice for us all the time and will work against this virus as well.
Emily Lazatin, CKNW.
Hi, Dr. Henry. We're getting some mixed messages from President Trump and his doctors about how long he should have quarantined for and how long he's contagious. If someone tests positive here in BC, how long is that person contagious for, and how long should someone really isolate? Can you spell it out or make it clear for British Columbians?
Obviously, I can't speak with any degree of understanding of what's happening with the U.S. president, but I can say that what we have learned is that when people have, particularly if you have mild illness and you're not in hospital, if you test positive for the disease, most people stop shedding viable virus. So viruses, they're no longer infectious to others after about 8 to 10 days. And if you're recovering, your fever's gone away, and and some people do have lingering symptoms, as we talked about, feeling of fatigue and cough that can go on for some time. But if you're generally getting better and you no longer have a fever, then most people are not infectious to others after 10 days. And that's what we use here in BC and across Canada. The caveat is it's different for some people. If your immune system is not working very well because you're on cancer treatments or taking certain medications, you may actually take a longer time for your body to clear the virus, and you can shed it for a longer period of time. And that's what we call live virus. And if you're in hospital, it can also mean that you're shedding more virus. People who are sicker tend to have more virus for a longer period of time that can infect others. So the tests that we use, it depends a little bit, because the tests we use, the Nat Test, the nucleic acid tests, are very sensitive, and they pick up small amounts of the virus. And we're seeing that now. One of the long-term care homes that we had an outbreak in March in Harrow Park, and a repeat one, some people still test positive with the test that we use, but it's not live virus. It's just pieces of the RNA from the virus that are still in the body. So it is a bit of a complicated thing, but for the most part, particularly milder illness in the community, we don't consider you infectious to others anymore after 10 days.
Do you have a follow-up, Emily?
Yes, I just want to add to that. He now claims he's immune to COVID-19, and we know immunity hasn't been proven. Are you worried that sends the wrong message to some British Columbians, since we listen to American news or are inundated with American news?
Yeah, well, yes, and this is something we're learning around the globe. You know, what is immunity? How much antibody do you need to have? How long does it last? There are some studies now that are showing, and obviously this is important to us because it will also give us some ideas about how a vaccine will work. We do know that most people develop some type of immunity from antibodies for at least a period of months, but you know, we've only been studying this virus really since January, so we don't know how long that will last. There is some evidence that we have what we call B cells and T cells that are part of our immune system, and that they can provide us with longer lasting immunity, and that's a good thing. That means that a vaccine will probably be effective for a period for a good period of time. So there's many different things that we still don't know about immunity yet. So we don't know if you have to have a certain level of antibodies or a certain level of your cell-mediated immunity stimulated to have longer-lasting protection. But those are all things under active study right now.
Next question is from Jane Side, North Shore News.
Hi, Dr. Henry. My question is about the sports activities and the sorts of risks that they are presenting. Here on the North Shore, we've had a couple of sports clubs that have either been shut or have had part of their facilities shut. We've also had a number of exposures in local schools, and I am just wondering whether a number of the school exposures, people in the school community who have tested positive, have been linked back to those sports clubs, particularly ones where people were gathering and spectating indoors.
So we know that exposures in schools reflect what's going on in the community, and we know that there have been exposure events in communities, and that has led to people who either work or go to school being positive, not realizing that they have the illness, and some exposure events related to both ways.
Do you have a follow-up, Jane?
Well, I guess I'm just wondering, we've had a number of exposure events that have occurred, and there is some confusion perhaps as to how many of the positive cases that have seemingly clustered in schools are actually ones that have been transmitted in schools versus ones that may have been transmitted with activities that are happening out of schools that are affecting, students who obviously go to schools.
Yeah, and those are the things that the public health teams look at every single case, and we can say with across the province that there have been both things happening. There have been very limited, small numbers of transmission events in schools. There have been transmission events with school-age children who are together outside of school, and also with families who've been in activities together outside of the school as well. So those are the things, that the very details of which the local public health teams put together, and that's how we know, how we're confident that we're not seeing widespread transmission or outbreaks in our schools across the province. And I think we're doing a very good job at making sure that we're finding all of the different exposure events and where people could have transmitted to others, so that we can find those people who are at risk in each of those settings.
We have time for one more question today. For everyone listening, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for this. I know the number of people in self-isolation or under public health surveillance is now in excess of 3,600 people, an increase of almost 500 since Friday. Just when we hit 1,000, that seemed to be a big deal. Now we're approaching 4,000. I'm just wondering, from a resources perspective, how much more challenging is this for your team to keep track of what is a steadily growing number of people? And is it going to reach a point where not everyone can be always checked on?
Yeah, so this is something that we started reporting after the July 1st long weekend, because I really wanted people to understand the work that public health teams were doing in finding people who are at risk and supporting them. As we know, when somebody's had an exposure to this virus, they often have a lot of questions about what their risk is, what they need to do, and then we support people if and when they develop symptoms to make sure they get tested as well. And yes, we've seen an increase as we've seen our numbers increase, and that reflects the numbers of contacts that people are having. And that's why it's so important that we try and minimize those. Keep our groups as small as possible outside of those key things that we need to keep our community going, including our schools and our workplaces. So yes, we have also spent quite a bit of time over the last few months hiring and training contact tracers. You've heard Minister Dix report on that over the previous weeks. So we've got several hundred new people working on public health teams around the province to help support this important work, because it is that balance of us all doing our part, which people in BC are doing well, and public health being able to find people and support them to self-isolate when they need to after an exposure.
Keith, do you have a follow-up?
Yes, I might as well finish up with sports, since you flagged sports as a concern in your presentation. I'm just wondering, in terms of context, are you sort of addressing this now before it gets out of hand, or are you concerned with what you're seeing right now in terms of closure of facilities or just cases being transmitted?
It's more preventive. You know, we've started to see, as some of the community leagues have gotten going again, they do have measures in place, but there's also a lot of enthusiasm for them where we haven't had some of those sports for some time. So it's just a caution to people. We've seen some transmission, particularly in spectators whose children are playing, whether that's indoors in an arena or in a sports field, and we need to step back and remember that even though it's we want to see everything that our child is doing, that this is the time to focus on letting them play and play safely, and making sure that we keep our distance, our safe distance from others, so that we don't jeopardize these sports teams. And also, you know, I'm hearing lots of reports of people being involved in multiple different activities, and this is a time where we need to whittle it down, make sure we keeping our contacts smaller. Pick the one that's important to you and stick with that group of people, rather than having different groups of people that you're playing hockey or ball hockey or soccer with on different days.
That's all the time we have today. Thank you, everyone, for joining us.
Thank you.